Hi there, I'm Dr. Ajaya Kashyap, and today I'll be talking about lipedema or lipedema as it is called. It is essentially a swelling of the legs or the arms, and it is to be distinguished from obesity or just being fat. There is an accumulation of fat and connective tissue in the extremities, which means the buttocks, the hips, the thighs, and the lower legs. Also, sometimes the arms. It spares the ankles and the hands. So there will be a swelling of the extremities depending on the type or the stage of lymphedema or lipedema. It would affect one part of the legs or one part of the arms or the other. But it does spare the trunk overall, other than the lower part, and it does spare the ankles and the hands. So it is a swelling of those parts, and the swelling is usually of fat as well as some connective tissue. But it is to be distinguished from just having fat or lipodystrophy, and also from distinguished also from lymphedema, which is accumulation of lymph, and that also causes the extremities to swell up. Now, this is diagnosed in very few people because a lot of people think it is just fat, and they would either diagnose it as fat, or a person just having gained weight for no reason and not having enough control over their diet and exercise and so on, or sometimes for lymphedema, which is accumulation of lymph, and that is something which happens more in the lower extremities, and that can be treated with different techniques, but they are not the same techniques as for lipedema or lipedema. Now, what are the symptoms? How do you know that you have lipedema or lipedema? Lipedema is diagnosed in less than 1% of the people who are affected by it, and an estimate is that 1 in 10 ladies, or almost 11% of the ladies, are affected by lipedema. It is almost exclusively in females. So, female hormones have a role to play. There are other factors that are important in the causation of lipedema. But how does one know that one has lipedema? Well, the first thing that one sees is just accumulation of fat in a certain area, which is disproportionate to the rest of the body. So let's say it's in the upper thighs. It suddenly from the waist, the body balloons up and it looks more fat and good proportion. However, this part of the body goes out of proportion and suddenly balloons up. Sometimes this can happen in just the lower legs or just the arms, but very often it starts with the legs. So the first thing that one notices is that between the fat there are some bumps, or even without too much fat, you can feel some bumps of the skin. There can be some pain. The pain is usually due to mild inflammation, which can become less or more. However, there is almost constant finding of pain on applying pressure to the area. The amount of pain can vary. It can be mild pain or just pain on pressure, or it can be severe to the extent of being debilitating. And some patients are not even able to walk or continue with their normal activities. Now, there's a constant feeling of heaviness in the extremities wherever whatever is involved, the legs or the arms or the thighs. There is swelling which can go up and down, often with phases of inflammation. And with inflammation, when it is more severe, there can be redness as well. There will be some uneasiness. There will be some fatigue when, after walking some time, person feels because of the heaviness, some fatigue in the legs, and they may have to sit down and raise their legs up to get some relief from this pain, the fatigue, as well as the heaviness. Now, what are the causes of lipedema? The first, of course, as mentioned, is having female hormones. Being a woman predisposes one to lipedema. And as I said, almost 1 in 10 ladies, or slightly more than that, are having some form of lipedema, most often mild, but sometimes it can get more severe at different stages of time, or different stages of life, rather. The stages of life that predispose one to having the problem are puberty, pregnancy, menopause, or taking oral contraceptive, all having to do with hormonal changes in the female body. Now, if someone has obesity, is overall having high volume of fat, say greater than 35% BMI, those people are more prone to have lymphedema and lipedema both. but the lipedema increases if the person has obesity overall. Now, what are the uh, complications one can have from lipedema other than the symptoms and problems with walking, carrying on with routine activities? Some venous diseases, there can be spider veins, there can be some varicose veins. One can have actual lymphedema that develops with time with lipedema, which means lymph also accumulates, and that can become an issue as well. The other thing one can have is flat feet, or even the knees may come together, a condition called knock knees, and the legs kind of rub together, and it becomes difficult to walk because of that. The other thing that happens is the functional part of it, meaning besides the walking and the routine activities, one can also have psychiatric issues like anxiety, and the um, cosmetic problems also can affect some people in terms of making them depressed or anxious about how they look. Now, there are many types of lipedema depending on what parts are affected. The first type is when it affects everything from the belly button down to the hips, so the upper third of the lower part of the body. Then the second stage can be it can when the lipedema occurs from the pelvis to the knees. The third part is when it occurs from the pelvis all the way down to the ankles. The fourth stage is when it occurs in the upper extremity, mostly from shoulders to wrists or sometimes to the elbows. And the last type 5, is when it occurs when it is isolated to the part between the knees and the ankles. When it is very severe, it can affect all of these. So it can affect everything from the navel down to the ankles, and it can even come from the shoulders down to the hands or to the wrists. So those are the different types and how it affects different people. How do we diagnose it? It's mostly a clinical diagnosis. So what you feel is you feel the extremity, the arms or the legs swollen up, and it is not something that pits. You don't, it doesn't. It's not like pitting edema, which is the swelling. When you push it down, it causes a little pit, which goes away with time. That is edema, and that has to be distinguished from lipedema, which does not do too much pitting. You can press it and it stays there, and the person will have some discomfort or pain on pressing it. So that is one part of lipedema that is very common. On pressure, they will have discomfort or pain. The second thing is you may feel some lumps beneath the skin. So it's not isolated. There are some isolated lumps that you'll feel in between the even distribution of fat beneath the skin. So that lumpiness is also a sign of lymphedema. It's not like cellulite. It's deeper than cellulite, but it is like having bigger lumps beneath the skin. One can do an MRI or an ultrasound, which will give some idea as to what's going on. Now, there are multiple stages of lipedema depending on how severe the disease is. This is to be distinguished from the types of lipedema. The types basically are about what parts are affected. The stages are the severity. So initially, most people start with type 1, where all you can do is the skin is normal, but you can feel some lumpiness. Then the type 2, when the skin itself feels lumpy and there is some dimpling. So you'll have little unevenness and dimpling. The third type is when the extremity just balloons up, and you can have some folds of skin and fat hanging down. And the last one is when the last stage, or the stage 4, is when there is lymphedema. Lymph also accumulates in addition to lipedema. In addition to the fat, the laxity of the skin, the folds, you also have lymphedema. What are the treatments for lipedema? The first treatment is to first prevent the what makes it go up and down, the swelling go up and down, which is inflammation. So what you do for that is you decrease the amount of inflammatory diet one is taking. A lot of anti-inflammatory diets can be found on the net and in books, where certain kinds of food will cause less inflammation. What I use routinely for people is tell them to use less milk, less meat, and also to take some curcumin or turmeric in their diet. The next thing one has to do is think of other anti-inflammatory herbals and medications that are of alternative medicines, which would decrease the inflammation overall. Some supplements do that as well. The next thing is compression garments or compression stockings, which have a gradient of low gradient 15 to 30, which would keep the compression on the extremities constantly. The next thing would be to, if it is in the legs, to lift your legs up as much as you can when you after you're done walking. But walking is very important, and having an active lifestyle. Activities are to be encouraged. You should not stop doing those activities, because those actually end up helping you in the blood circulation and avoiding inflammation in the areas. So activities, walking, jogging, and not only permitted, is encouraged. And but while doing them, you should have some compression stockings on, compression garments if it's in the upper part of the body. Skincare is very important, especially in winters. You need to make sure that your skin is moisturized and avoid any skin infections, because again, if the skin gets infected, it can become worse. One thing I often advise people to do is, whenever there's a little more inflammation, to take Arnica montana, which is a homeopathic medicine. And if you don't believe in it, don't take it. But I have seen good results with Arnica montana, which I'd give routinely after doing liposuction as well. The other treatments that I advise, especially after having some procedures done, which I will come to, is pneumatic pumps. You keep them at a low pressure, but they will be very helpful in decreasing the inflammation as well as the swelling of the legs or the arms. These compression pumps are very simple and pretty cheap to buy now. They come with a little motor, and to them are attached some sleeves or some leggings, and they have different compartments which will keep compressing and then relaxing the different compartments, and they help with the legs having more better circulation and being able to mobilize more of the fluid. Also, massages can help. Lymphatic massages are very helpful, as long as they are done gently. Make sure, if you have someone do it, not to overdo them. So people who do lymphatic massages and are used to doing lymphatic massages will understand how to do them. The last thing, and the most important thing, at least in my practice, when a lot of fat is accumulated, is liposuction with the water jet technique. Liposuction with the water jet technique will spare the lymphatics. And I usually don't do circumferential. I would do 3/4 of a circumference, just so that even a little bit of lymphatics that are, the little bit of circumference that is left will decrease the amount of swelling that can happen post-operatively. So water jet is a wonderful technique for liposuction, where initially the jets of water will dislodge the fat cells, and then they can be sucked out without damaging the tiny little lymphatics, which would help decrease the volume without damaging the lymphatic, which can carry the fluids way up to the heart. So water jet liposuction is the only one that I would recommend. And anyone who gets a liposuction done, make sure you go to a qualified, board certified plastic surgeon, someone who's been doing this treatment, who has this equipment, and who's used to dealing with lipedema and patients who have these problems. Last of all, and it's very important, is support. So you need to have a lot of support from the family. Join support groups if you can. Read a lot about it. Don't get obsessed with it though, and carry on with your usual activities. And the family has to be supportive and not to indulge in body shaming or fat shaming the individuals who are suffering from this. It is a disease. It is not something which is because of eating too much or because of inactivity. Well, let us know if you have any questions. Our contact information is down below. I'll be glad to answer any questions if you have any. Thank you very much for watching.